We are now looking at the anterior portion of the hip and upper leg. This muscle here that attaches to the spinal column is the psoas major. This muscle will merge with the iliacus to form the iliopsoas. So we have the psoas major here, and then the iliacus here, and they will become the iliopsoas. As a little review, this line here is the inguinal ligament. This muscle here is the tensor fasciae Latae. But that's really boring, so I like to pronounce it tensor fasciae Latae. This muscle will merge and become the iliotibial band. If we remove the tensor fasciae Latae, we can see this tiny sliver of the gluteus minimus. This long muscle here is the Sartorius, and it can be remembered because it is the seatbelt of the leg. So again, it is the Sartorius. We are now going to remove it so we can see a clear view of the Quadriceps femoris, commonly called the quads. This is a group of 4 muscles. This middle one that points directly to the knee is the Rectus femoris. One way to remember these muscles is that King Rectus sits over his vast kingdom. This will make more sense when we remove the Rectus femoris and see the last 3 muscles. These will all start with the word vastus and then are named based off of location. So laterally, we have the Vastus lateralis, and in the middle, we have Vastus intermedius, and then medially, we have Vastus medialis. So King Rick sits over his vast kingdom. Heading more superiorly and medially, we have this muscle here, which is the Pectineus. Below that, this tiny sliver of a muscle is part of the Adductor Brevis. You can remember this because the Brevis is in the crevice. Continually medially, we have this muscle here, which is the Adductor Longus. Rotating the leg so we're looking directly medially, we can see this large middle muscle, which is the Gracilis. Deep and posterior to this, we can see another view of our adductor Magnus. And that concludes our upper leg muscles.